All right, everyone, welcome back for another deep dive. We're going to be looking at a case study today
Oh, cool.
from the OpenStax Microbiology textbook. If you want to follow along, the link is down in the video description.
Great.
And full disclosure right up front, this is a fictional case, but it really illustrates some important concepts about infections and how they're treated.
Absolutely. These kinds of cases, even though they're made up, they can really help us understand the complexity of diagnosis and treatment.
Yeah, for sure.
Picture this. We've got David, a 35-year-old carpenter, who also happens to be dealing with Crohn's disease. He starts feeling sick, the usual suspects: fever, cough, even some shortness of breath.
Classic signs of a respiratory infection, right?
Totally. And to make things even more convincing, his doctor finds some consolidation in one of his lungs on an X-ray.
Right, which would, definitely point towards something like pneumonia.
Exactly. So the doctor prescribes levofloxacin, a common antibiotic for respiratory infections.
Makes sense. Levofloxacin is a quinolone antibiotic. And it's usually very effective against the bacteria that cause these kinds of infections.
Okay. But here's where things take a turn for the worse.
Oh.
A week goes by. David's not getting better. In fact, he's feeling even worse.
Oh, no, that's not good.
Yeah.
So what happened? Did the antibiotic not work?
Well, that's what's so interesting about this case. Not only are his initial symptoms still hanging around, but he's developed new ones. Terrible headaches, a stiff neck, trouble concentrating.
Whoa, hold on. Those are not your typical cold or flu symptoms.
Yeah.
Especially that stiff neck. That's a red flag.
Yeah. And to top it all off, he's got a rash on his arms. Doesn't sound like a simple respiratory infection anymore, does it?
Definitely not. Those new symptoms, especially the stiff neck and the cognitive issues, they suggest that something else might be going on, possibly even an infection of the nervous system.
Oh, okay. So things are getting a little more serious. So what happens next? What does the doctor do?
Well, faced with these new and frankly concerning symptoms, the doctor decides to dig a little deeper.
Oh, okay.
He orders a spinal tap.
To analyze David's cerebrospinal fluid.
And remind us, what is that exactly?
Right. So cerebrospinal fluid, or CSF, it's this fluid that surrounds the brain and the spinal cord.
Okay.
And it acts as a cushion, protecting them. But it also gives us a way to see what's going on in the central nervous system.
Gotcha. So it's like a window into the health of the brain and spinal cord.
Exactly. A very important window.
Okay. So what did they see when they looked through that window in David's case?
Well, they found something that completely shifted the diagnosis: encapsulated yeast cells in his CSF. And this finding immediately told us we're not dealing with a bacterial infection,
Right.
but a fungal infection, and a serious one at that.
A fungal infection in the brain. That sounds pretty scary.
It can be, yeah. The specific culprit here is a fungus called Cryptococcus neoformans. Cryptococcus neoformans. It's a type of yeast that can cause something called cryptococcal meningitis.
Okay, and what is meningitis exactly?
Meningitis is an inflammation of the membranes that's around the brain and spinal cord.
Oh, wow.
So, yeah, not something to take lightly.
No, not at all. Okay, so we've gone from a suspected bacterial infection to a fungal infection in the brain.
Yeah.
How did this happen? I mean, how does someone just encounter this Cryptococcus?
Cryptococcus neoformans.
Yeah, Cryptococcus neoformans, right. It's not like it's just floating around waiting to pounce, is it?
Well, not exactly lying in wait, but it is more common than you might think. Cryptococcus neoformans is found in the soil.
Oh,
and get ready for this: bird droppings.
Bird dropping, seriously. So was David, like, cleaning out a pigeon coop or something?
Not quite. Remember, he's a carpenter. Well, he had been working on this old barn, dismantling it. And that's likely where he inhaled the fungal spores.
So you're telling me tearing down an old barn can lead to a fungal brain infection?
It's definitely possible, especially if someone's immune system is compromised,
Oh,
which
wow.
brings us to another important point.
Right, because if this fungus is so common, why don't we all have fungal meningitis?
That's a great question. And the answer lies in the immune system in healthy individuals with a strong immune system.
Yeah.
Exposure to Cryptococcus neoformans rarely leads to serious infection. The immune system is really good at recognizing and eliminating these fungal invaders.
So the immune system is like our personal bodyguard, keeping all these microscopic threats at bay.
Exactly. But in David's case, something wasn't quite right with his immune system.
Right, because it is Crohn's disease.
Exactly. Remember, he was managing his Crohn's disease with medication, and it turns out the medication he was taking, a corticosteroid, was suppressing his immune system.
Oh, okay. So the medication that was helping him manage one condition was making him more vulnerable to this other infection.
That's right. It's a bit of a double-edged sword sometimes.
Wow, that's a tough break for David.
Okay.
So what happened next? Did they figure out a way to treat this fungal meningitis?
They did. The doctor immediately switched David's treatment to antifungal medications.
Okay.
Amphotericin B and flucytosine.
Those sound intense.
They're powerful drugs, specifically designed to target and kill fungi.
Okay.
So these were essential for combating the infection and giving David's weakened immune system a fighting chance. Yeah, it can be a tricky situation. You know, you need to control the inflammation from Crohn's.
Right.
But at the same time, you don't want to weaken the immune system too much.
Exactly. It's a real balancing act.
It is.
So you mentioned earlier that the yeast cells they found in David's spinal fluid were encapsulated.
Right.
What does that mean exactly, and why is it important?
That's a great question. So a lot of microbes like bacteria and fungi, they have this outer layer called a capsule.
Okay.
And it's basically like a shield made of sugars that helps them hide from the immune system.
So it's like a microscopic invisibility cloak.
Yeah, that's a good way to put it.
Yeah.
And for Cryptococcus neoformans, this capsule is particularly thick and difficult for the immune system to break down.
Okay, so that explains why the antibiotic didn't work. It wasn't able to get through that capsule.
Exactly. Antibiotics target bacteria, not fungi.
Right.
And even if they could target fungi, they'd have a hard time getting past that capsule.
Gotcha. So that's why they switched him to those antifungal medications you mentioned, the amphotericin B and flucytosine.
Right. Those medications are specifically designed to target and kill fungi.
Okay, so how do they actually work? What do they do to the fungus?
Well, amphotericin B, it kind of acts like a saboteur.
Okay.
It binds to this component of the fungal cell membrane called ergosterol, and it disrupts the membrane, essentially making the fungus leaky.
So it's like poking holes in its armor.
Yeah, exactly. It weakens the fungus and eventually kills it.
Wow, that's pretty cool.
It is.
What about the other one, the flucytosine?
Flucytosine, that's more of a stealth operative. It's what we call a prodrug, which means it gets converted into its active form once it's inside the fungal cell.
Interesting.
Yeah, and then this active form goes in and messes with the fungus's DNA and RNA synthesis, preventing it from growing and replicating.
So one attacks the cell membrane, the other attacks its genetic blueprint. A 1-2 punch.
That's a good way to think about it, yeah. We use both medications because, well, one reason is that we're dealing with an infection in a very protected area, the central nervous system.
Right, the blood-brain barrier and all that.
Exactly. And that barrier makes it hard for medications to get to where they need to go.
So using two medications increases the chances of actually reaching the infection and treating it effectively.
Exactly.
Plus, David's immune system is already weakened.
Right, so those antifungal medications really need to do the heavy lifting here.
So it's not just about taking a pill and hoping for the best.
No, not at all.
It's about understanding the complexities of the infection, the immune system, the medications. It's like a real medical puzzle.
Yeah, a puzzle with very high stakes.
This case really highlights how important it is to have a doctor who can put all those pieces together.
Absolutely. Treating infections, especially those in the central nervous system, it requires a deep understanding of microbiology, pharmacology, immunology, you name it.
It's a team effort. It is. And luckily for David, his doctor was able to figure it all out and get him on the right treatment plan.
That's great to hear. But we're not done with this deep dive yet. There's still more to explore, so stick around for the final part, where we'll talk about the broader implications of David's case and what we can all learn from it. And we're back for the final part of our deep dive into this fascinating case of what turned out to be cryptococcal meningitis.
It's definitely been a journey.
Yeah, starting with what seemed like a straightforward respiratory infection.
Right, really shows you how important it is to consider all the possibilities.
And how crucial the immune system is in all of this.
Absolutely.
I mean, David's case really highlights how even a slight dip in immune function can leave you vulnerable to these unusual infections.
Exactly, and it makes you think about all the things that can affect our immune system.
Yeah.
You know, not just medications.
Right, like stress, lack of sleep, poor diet.
All of that plays a role.
So we've learned that this fungus, Cryptococcus neoformans,
is often found in food droppings.
Yeah.
Should we all be worried about, encountering it in our daily lives?
Well, It's out there, that's for sure. But for most healthy people, it's not a major threat.
Okay,
Our immune systems are usually strong enough to handle it.
gotcha. So it's not about avoiding the outdoors or anything like that?
No, not at all. It's about making sure our immune system is in tip-top shape.
So what are some things we can do to support our immune system?
Well, a lot of it comes down to the basics. Eating a healthy diet,
Okay.
lots of fruits, vegetables, whole grains,
Yeah.
getting enough sleep, managing stress.
Yeah, the things our moms always told us.
Exactly, Mom was right. And regular exercise, too, that's important.
Right, it all makes a difference.
It does.
And it's not just about preventing infections, it's about overall well-being.
Absolutely. A healthy immune system helps us in so many ways.
Definitely. So, any other words of wisdom for our listeners before we wrap things up?
Well, I think it's important to be aware of the signs and symptoms of infection, especially when it comes to the central nervous system. Things like a high fever, stiff neck, severe headaches, confusion, seizures.
Yeah, those are red flags.
Exactly. Don't ignore those. Seek medical attention right away.
Always better to be safe than sorry.
Absolutely.
Well, this has been an incredibly informative deep dive. Thank you so much for breaking down this case for us.
My pleasure. Always happy to talk about microbiology.
And to our listeners, thank you for joining us. Remember, knowledge is power.
It is.
The more we understand about our bodies and how they work, the better we can take care of ourselves.
Couldn't agree more.
So stay curious, stay informed, and until next time, stay healthy.